Hello, my name is Merrill Tanner. I'm doing this video to replace the video that didn't really happen on November 1st, 2024 at the SingWell Toronto Symposium. So I'm here to talk to you about singing and voice treatment for people with interstitial lung disease. I'll tell you a bit about my background. I'm a speech-language pathologist and a trained classical singer. And I did a PhD in rehabilitation science on using singing for voice improvement in Parkinson's disease. But I also did a little study with two respiratory doctors on interstitial lung disease. And I chose this topic because it's rarely studied in this context with singing as a treatment. So we'll move to the next slide. So these are the two lovely ladies that are respiratory therapists in Edmonton, Alberta, Canada, and they wanted me to do this study with some of their patients, hoping that there would be some change in mood and maybe some socialization. That's what they were hoping. I've done a lot of clinical work combining singing and speech pathology in individual therapy and in group therapy for voice, language, stuttering, dysarthria, apraxia, dementia, and deconditioning from aging or from disease, and Parkinson's disease. So, and I've also established a number of vocal strengthening groups at the Glenrose and in the community. So in August of 2015, I did a 1-month study on people with interstitial lung disease. Okay. So interstitial lung disease is fairly rare. There are two types of interstitial lung disease. I do have it up here, don't I? Yes, I do. So one is inflammatory, and that is easier to manage medically with medications. And then there is also a fibrotic interstitial lung disease, which is very hard to manage and has a very high mortality rate. Sometimes the inflammatory does change into the fibrotic, but as long as you're have an inflammatory problem, then they can help you. The fibrotic one, people die quickly, unexpectedly, and it can affect even very young people. It's not well understood. So I think that this disease, of all the lung diseases we have, is less studied because people are afraid of that fibrotic element that might cause problems, or it's a bit scarier to deal with. But most interstitial lung disease are inflammatory, so we shouldn't really shy away from it. So voice training is kind of like what you do for an athlete. You're getting people to do a more vigorous use of their voice, and it helps their respiration, their resonance, their posture, and their laryngeal efficiency. The physical benefits mean that you have a better voice quality and better respiration and vocal resiliency, so you don't lose your voice as easily, less vocal fatigue, and maintenance of laryngeal and respiratory health. Also, you might have some protection against swallowing issues and aspiration pneumonia. The mental benefits are improved mood, socialization in a group, and reduced loneliness and reduced doctor visits. So, having good voice quality makes your speech more intelligible and easier to understand, and improves your communication. likely improves your socialization as well. It also improves your vocal resiliency. This is especially important to people that are working because 1/3 of all modern jobs require a good voice. Laryngeal health, as I said, if you have good laryngeal health, you have improved airway protection and protection for aspiration pneumonia and improved swallowing, and lung health, better respiration and respiration management. So there's quite a number of advantages to having this happen in a group. People feel more relaxed about singing because they're not the only one singing, they're not doing a solo. They also are still a member of a creative activity. There's socialization opportunities in the group, and they can really participate at any level that they want. I mean, they don't have to sing even. They could be just listening, but most people end up singing when they come. But your vocal skill and your musical skill is kind of irrelevant. We have lots of things in place that help you with that. There's no prior skills required. The choral and Lombard effects are also interesting. If you know anything about them, the choral effect essentially means that when you're singing or speaking together, it comes more easily. The Lombard effect means that it's also called the cocktail party effect. So when you're in an environment where other people are singing, you tend to use your voice more and be louder. It can also be used like individually, but it's more economical and in some ways more fun in a group. So your leader needs to have voice training skills, really important. Facilitation skills for group work, and knowledge of rehabilitation and of the diseases that people have in the group. So, as I mentioned, there's not a lot of studies on singing and interstitial lung disease. I did find it in one study that was completed in 2022, where they had COPD, lung cancer, and interstitial lung disease. Most past studies on singing and lung problems include maybe asthma, COPD, emphysema, and lung cancer. So all of these studies showed beneficial effects. So our protocol was to do warm-up exercises using the voice, including facilitating exercises that loosen muscles that help with vocal production. Then we do lots of voice building exercises from singing and speech pathology, and breathing exercises that involve voice, and then song singing, trying to keep that vocal technique awake and going while they do it, and singing at home was also encouraged. Okay, this was a small study. We ended up in the end with only 4 subjects. They met twice weekly for 4 weeks. The initial sessions were half an hour long as advised by the doctors, but they were expanded to 1 hour in length at the request of the participants. Treatment included vocal exercises, semi-included vocal tract exercises, postural exercises, open throat exercises, vocal hygiene and how to keep your vocal health, breathing techniques, and song singing. Attendance was variable because all participants were living in the community and juggling work and/or children and the limitations of their disease. Oops. So it's very important to have it fun. I think I've covered some of the other things on this slide. Abdominal and chest wall expansion is very important, with dynamic energy, not rigid energy. Connection between the voice and the body, and reduction of tension that you don't need. So, the results. Got it on there? Oh, no, I never changed it. Okay. Results. The respiratory results, these I was not involved in. The pulmonary rehab team completed this testing. So before and after, they tested various things, which I have a list of if you want more detail on that. So the results were that 2 participants had improved by functional vital capacity and reduced breathlessness, and this was an unexpected result. The doctors were quite surprised that anything that they would measure would change. They did not expect such a change. 1 participant had a cough that disappeared, and another one had a better clinical global impression of improvement. So I'll give you that information if that's what you're looking for. I myself did the vocal pre and post assessment, and the results were that average pitch during reading improved in all 4 participants. That means that if their voice was a bit high or a bit low, it normalized and went into what we call, it's kind of the sweet spot in the voice where you should be speaking all of the time, which is also healthier for the voice. The maximum phonation time is how long you can hold a vowel, improved in 4 participants, all 4 participants. And the loudness range and pitch range improved in 3 of the 4 participants. Perceptual ratings improved in 3 out of 4 participants. So, the comments were really interesting, I found. All participants said that they had enjoyed the group and would like it to continue. 1 person wanted the frequency to change to 3 times a week. 2 people felt their coughing had decreased, while another felt that her throat was more relaxed. 2 people started previous vocal activities they had stopped, singing along with the radio, and 1 other person participation in a choir. 2 people commented that the quality or clarity of their speaking and singing voices had improved. 2 others reported improvement in higher pitch range. All had 1 or more of these comments: improved mood, more confidence, benefits from having fun with peers suffering from the same disease, and 2 people felt that the techniques learned would help them with overall breath management. So there is a bias because I was a facilitator of the group and I also did some of the assessment. But I don't think there's any bias on the respiratory ones. And those were probably the most significant findings. I do think that the participants felt that they had more power, were empowered by what we did, and they understood the voice more and could manage their breathing a little bit better. So all of the group wanted to continue the singing program, and I think there were some long-term effects, and they were able to apply them. So thank you for listening, and I have a little bit more detail on some of the other things here. So I'm not going to go into that. But there was a question in the, here's the pulmonary testing measures, perceptual and objective, that were used by the pulmonary team. And here are the voice measures. And there's pulmonary testing, and there's the voice measures. Okay, so there was a question in the presentation about what did I use to take these measures. So, I didn't mention that we had a pianist the whole time that helped us with the singing, and that's one thing I forgot to mention. These measurements I took before and after the 4 weeks, and I took acoustic measures with the Voice Analyst app for iPad, and I was careful to keep the distance to the microphone on the iPad the same with each person. So I measured pitch and loudness while reading, counting, and talking. And I measured pitch range, sliding from lowest to highest pitch and back. I measured loudness range, asking them to say a phrase as loud as they could and as quietly as possible. And then took the two numbers and subtracted. And I converted the pitch range into actual notes from the hertz. Maximum phonation time was the best of 3 trials. And for my perceptual assessment, I listened to the voice quality rated by listening to the pre and post tapes of the assessments. So, and there's more detailed information on some of the other respiratory tests if you're interested in that. So I'm going to go back to this one with my information on it. And thank you very much for listening, and you can contact me with any questions you might have about the study. Thank you very much for listening.